Hi, I'm Dr. Rena Azar for Dr. Brainwaves, and today we're going to talk about what can make intercourse uncomfortable. So one thing I want to cover is the relationships of the anatomy. We have the bony pelvis, which you can look at in more depth in my pelvic bowl content video. We have the relationship between the uterus with the vagina coming down and out, and the bladder in front of it, the rectum behind it. These are the tubes and ovaries to the side. We've got a lot of musculature here around the outside of the vagina. So that's a lot of things going on in the pelvic area. So one basic concept is that oftentimes, even though intercourse feels uncomfortable in the vagina, really there are many processes that can cause discomfort with intercourse that are unrelated to the gynecologic tracts. For example, something in the bladder because it sits right next to the vagina. A condition in the bladder can cause pain with intercourse. A condition with the colon or bowel can cause pain with intercourse. So there are infectious diseases that can cause pain. We can get, for example, STDs, pelvic inflammatory disease, but we can also get something like diverticulitis, which is on the colon, that can cause pain with intercourse. Yeast infection in the vagina can cause pain with intercourse. There are skin conditions that can cause pain with intercourse. People can get herpes, which causes open sores, lichen sclerosis, which causes also open sores, dryness and irritation of the skin. There's a general condition called atrophy, where the vaginal tissues and the vulvar tissues become thin. I have a whole video on that as well. That's usually a menopausal state, but it can be an estrogen state that's just low for any other reason. And that can occur in your youth as well. So skin changes, infections, tumors, or growth. Sometimes they're benign, non-cancerous. Sometimes they're cancerous. And you can have tumors in the uterus, the cervix, the bowel, the bladder, the ovaries. Tumors in any of those areas could potentially cause pain with intercourse. There's a process called endometriosis where the lining of the uterus back fluxes through the tubes and spills out into the abdominal cavity. It also can burrow into the muscular wall of the uterus, and endometriosis can cause pain with intercourse. There's a video on that as well. And also prolapse. As women get older, particularly after childbirth, the support structures of the pelvis start to give way, and a uterus that's pushing down and out, bladder pushing down and out, for example, can cause pain with intercourse. They feel like a heaviness in the vaginal area. They're actually pushing into the vaginal cavity, and intercourse can cause pain by dislodging them or pushing them around. Muscular spasms, or tightness, voluntary or involuntary. You saw on that pelvic floor, lots of muscles that have to be bypassed during intercourse. So muscular areas of contraction can cause pain with intercourse. And of course, there are things like vaginal size. Sometimes people have a small vagina. That happens a little bit naturally when you go through your change of life and you go through menopause and have those thinning of the skin tissues down below. But oftentimes I will see people who've had a vaginal procedure, hysterectomy, colporrhaphy, that has actually physically shortened or decreased the caliber or diameter of the vagina. So those are many, many things that can cause pain with intercourse. And that's why we encourage people to come in and get that checked out with your doctor or provider. Thanks for visiting Dr. Brainwaves today.